Hi, my name is Jasmine Blair, and this is my patient care presentation on chronic kidney disease. So, I will be talking about a patient that I actually had a few weeks ago who is a 36-year-old female patient. She has a history of kidney failure, hypertension, high cholesterol, and obesity. This patient was admitted for kidney failure and hyperkalemia. Her potassium level was 6.1 in the emergency department. This patient was not very compliant with her current treatment regimen, and on the second day was attempting to leave AMA, saying that she had to go home, she had things to take care of, and she also admitted to occasionally oversleeping through her dialysis appointments, which she even said this most recent one she had before the hospitalization, she did sleep through and miss. And what surprised me about this patient was that she was particularly young to have kidney failure. When I was comparing her with the standard demographics for patients with kidney disease, I saw that she was one of the 6% of people with kidney disease that are in between the ages of 18 and 44. In fact, kidney disease actually mostly occurs in people over 60 years old, so I was pretty surprised that this 36-year-old female had kidney disease. When looking at the hypertension demographics, hypertension is a more common cause of kidney disease in adults, which may have been a contributing factor for this patient's kidney disease. Other factors that this patient had that could have contributed includes her history of obesity and high cholesterol. I was able to have this patient for 2 days on the clinical floor, which was nice because I was able to look at assessment data and compare with the day before, although I don't know exactly how this patient left or what is going on now. But when I was assessing this patient, especially on day 1, I concluded that this patient was holding on to fluid. This was evident because there was edema in the patient's legs, ankles, and feet, and they also had a pretty consistent high blood pressure. The assessment data made sense to me when I was looking at it and knowing what I know about kidney disease. Edema and hypertension can occur due to the kidneys not being able to remove the excess fluid from your body. So with all of the excess fluid stuck in her body, the fluid moved from the intravascular space to the interstitial space, which then created the edema in her legs. In addition, the extra fluid made her heart work harder, which then led to that hypertension. When I was looking at the patient's lab results, especially on that first day, there were some pretty significant lab results that I saw that made sense because of this person's chronic kidney disease. I saw that she had some albuminuria, which is just protein in the urine, along with her GFR being 45, and her potassium was 5.2, which definitely was an improvement from the 6.1 reading that they found while she was in the ER. The albuminuria is a good indicator of a damaged kidney. A urine albumin level that is elevated shows that either the treatments that are happening aren't working or the patient is not being compliant with the treatment regimen. And this assessment data makes sense because the patient admitted that she slept through the dialysis appointments. People with kidney disease do have a higher risk for hyperkalemia because it is the job of the kidneys to remove potassium from the body. So dialysis is necessary to help regulate that potassium. So the elevated potassium level is also likely because of the missed dialysis appointments that the patient admitted to. Because of all of the things that this patient had going on, I did put more than one goal on this slide. So the goals for this patient during the shift included lowering the patient's potassium to be in the range of 3.5 to 5, having the patient verbalize understanding of the importance of attending dialysis appointments, and to lower the patient's blood pressure. Interventions that were implemented to ensure that the patient was able to reach her goals before she left were, number 1, administering the prescribed diuretic furosemide. Number 2, ensuring that the patient was on continuous cardiac monitoring, making sure that they're not going through any arrhythmias because that high potassium can definitely make you go into an arrhythmia. Number 3, auscultating the lung and the heart sounds. You want to auscultate the lungs because if they are retaining so much fluid, you want to make sure that that is not backing up into the lungs, and you want to listen to the heart sounds again just to make sure that everything is pumping okay, that the potassium is not affecting the heart in any detrimental ways. Number 4, you want to check those vital signs, especially because they are retaining fluid, which makes their blood pressure go high. Number 5, you want to obtain daily weights. So obtaining a daily weight every single day at the beginning of the day, wearing the same thing or a similar thing, will show you if the patient is holding on to or losing fluids. Number 6, you want to have a strict intake and output so that you know exactly what is going in and what is coming out of the patient. And number 7, you want to teach about the importance of attending dialysis appointments. This one is especially important because it is very likely that the patient is admitted to the hospital because she wasn't going to her dialysis appointments. So we want to teach this patient that if she wants to avoid coming into the ER and being admitted to the hospital again, that she needs to go to her dialysis appointments and be compliant with her medication regimen and anything else that needs to happen for this patient to stay healthy. Intervention outcomes. So due to our interventions, we did achieve the goals that I had listed 2 slides previously. The intervention outcomes that I found on day 2 of taking care of the patient were, number 1, the patient's potassium did drop down to 4.8, which still is a little bit on the higher side of normal, but it is normal and it is progress from when she came into the ER and from the first day that I saw her. Number 2, the patient's blood pressure consistently stayed either within normal limits or slightly elevated, and this was due to some antihypertensive medications that this patient was put on. Number 3, the patient did verbalize understanding of attending dialysis appointments, along with agreeing to stay in the hospital instead of leaving AMA. And that was kind of a fight to get her to stay. I know there were a lot of people in there, doctors in there having her stay, but she did agree to stay, and she did verbalize understanding of the need to attend dialysis appointments. So this is my nursing care algorithm. I just looked at chronic kidney disease as a whole and then kind of broke it down into 4 different symptoms. And if you are experiencing any of those symptoms or assessment findings, basically it tells you what you need to do in order to reverse those so that you slow the progression of your disease. So number 1, you have chronic kidney disease. If you go all the way to the left, it says, is your GFR decreased? If it is, you want to administer antihypertensive medications to control the blood pressure. And then it tells you to go over. Check the blood pressure. Did the blood pressure decrease? If it did, good. That's all you have to do. If it didn't, I would contact the healthcare provider, and then you would complete the physician orders, whatever that might be, more medications, whatever else, and you would continue to monitor the patient and continue to get lab draws. Number 2, do you have elevated blood pressure? If you do, you would administer the prescribed antihypertensive, and then later you would check the blood pressure. Did the blood pressure decrease? It's the same as the decreased GFR. If not, contact the HCP, complete their orders, and continue to monitor. Are they having protein in the urine? If they are, administer the prescribed diuretics and or hypertensives. And then you will send a new sample to the lab. Did the protein level decrease when you got the lab findings back? If they did, great, that's all you have to do. If not, you would continue to monitor blood pressure and lab values and then keep the physician aware of the findings. And then lastly, if the patient is having elevated potassium, you would immediately place the patient on a cardiac monitor, again to check for those arrhythmias, and then you would administer the prescribed potassium-wasting diuretic. And then after that, you would monitor the cardiac rhythm to make sure that there are no arrhythmias, and then are the potassium levels decreasing. So you would look at those lab draws that come back. If they are not decreasing, you would continue to monitor the cardiac rhythm and then listen to the heart sounds and keep the physician aware. So a lot of these things, well, all 4 of these things my patient did have, and these are all things that we did or we would have to do if the findings did not go the way that we wanted them to. So in summary, chronic kidney disease is the failure for the kidneys to filter waste and excess fluid from the blood. Due to this failure, waste begins to build up and then the kidneys start to lose function. Treatment involves slowing progression of the disease, as the disease can progress to end-stage renal failure, which is fatal and might even require a kidney transplant to ensure that death isn't going to be the end result. A few complications of chronic kidney disease includes fluid retention, increased potassium, heart disease, and irreversible damage to the kidneys. And a few of these the patient that I had did have. The patient that I was able to care for 2 clinical days was admitted due to her high potassium levels, which was secondary to chronic kidney failure. Assessment findings in this patient included edema of the legs and feet and an elevated blood pressure. Lab findings showed that she did have protein in the urine, she had hyperkalemia, and she had a decreased GFR, which indicates chronic kidney failure. I helped to perform many interventions to reverse these findings, which some of these included administering furosemide, monitoring the vital signs, listening to the heart and lung sounds, and recording the intake and output. And the PCA did a few of those things too. She also did daily weights, I's and O's. And these interventions, they all helped to decrease the potassium and blood pressure, which really puts a lot of stress off of the kidneys. So in order for this patient to slow the progression of her disease, she will need to be compliant with the treatment plan and go to dialysis appointments, which she did verbalize understanding to do, but in the end, we can't hold their hand when they go out of the hospital, so I'm really hoping that she does do that.